Welcome to Is It True? And welcome to my scientific co-host, Iva Milinkovic.
It's a pleasure, Gerrit.
In this fast-paced program, leading experts from the world of implant dentistry challenge stereotypes and answer questions everyone has. Iva, who is the expert in this episode and what is the question?
Who would be better to answer this question than Professor David Nisand, coming from Paris, a periodontist and implantologist that has tremendous clinical experience in immediacy in implant dentistry. So let's see if it is true that immediate implant placement can always be an option in the aesthetic zone.
No, it's not true. Maybe I may say that patients should always be screened for immediate implant placement in the aesthetic zone. Because from a patient perspective, having only one surgery and replacing the hopeless tooth in one session is the best possible scenario. The best possible scenario as long as the aesthetic and the function last for years. And here comes the reality. Why on earth do we have to extract a tooth in the aesthetic zone in 2025 when we can push the boundaries of saving teeth with endodontic treatment, bonding solution, and periodontal regeneration? Well, because in many cases, extraction is the result of either a disease progress or a significant trauma which is associated with severe alveolar bone loss and/or midfacial recession. With this being said, the question becomes, in this usual clinical scenario with severe alveolar bone loss and/or midfacial recession, is it true that immediate implant placement can always be an option? Well, let's look at the evidence. According to the ITI Consensus Conference published in 2023, the Type 1A protocol for the replacement of a single tooth in the aesthetic zone should be considered the treatment of choice when ideal conditions are present, which include healthy adjacent teeth, no acute infection, intact facial bone, ability to place the implant in a correct 3D position, and anticipate implant primary stability to allow for immediate restoration. These are very strict selection criteria which are rarely fulfilled in daily clinical practice when saving teeth becomes your clinical priority. Well, of course, according to the EAO position paper on immediate implant placement, the indication for Type 1A protocol could be broadened to less favorable sockets, such as 2A and 2B, avoiding wide ascents and/or midfacial recession. But by saying this, we also have to keep in mind the outcome of a recent systematic review on immediate implant placement in intact versus non-intact sockets, which clearly show a significant discrepancy between the outcome, particularly for non-intact socket with only 2 RCT with a high risk of bias. So as a conclusion, given very strict selection criteria are fulfilled, immediate implant placement may be considered over alternative treatment concept as long as the surgeon is experienced and skilled.
Thank you for clarifying that this is actually not true.
And thank you for watching. Make sure you check out all the other Is It True videos to discover the latest scientific insights.